Good evening, everyone. Welcome to the latest Facebook Live Q&A from North Somerset Council. My name's Mike Bell. I'm the Deputy Leader of the Council and the Exec Member for Adult Social Care and Public Health. And I'm joined by some of my executive colleagues and some of our senior officers for tonight's Q&A, which is a back to school special. Can I say that it's a miracle that we've started on time here, because we've just had the worst introductory countdown known to man, which seemed to stop at 3 for some reason. So our first back to school challenge is obviously to teach our intro colleague how to count down from 5 to 0. Okay, so my first colleague to introduce himself is Don Davis. So Don.
Hi, I'm Don Davis. I'm leader of North Somerset Council, the Council of Pill and Alberts Lee. Yes, it's very concerning, the lack of numeracy skills already being demonstrated, isn't it? I'm sure we'll match them though during the course of this hour.
Thank you, Don. And Catherine?
Hi, I'm Catherine Gibbons and I'm the Executive Member for Children's Services and Lifelong Learning.
Thank you, Catherine. And Sheila, please.
Hello, I'm Sheila Smith. I'm the Director for People and Communities in the Council.
Thank you, Sheila. And Matt.
Hi everyone, I'm Matt Lenny. I'm the Director of Public Health for North Somerset.
So you've got a very high-powered lineup here tonight. Normally on these Q&As we only have elected councillors, but on this occasion we've opted to have some people who actually know what they're talking about with us as well. So we're very pleased to have and grateful to have Sheila and Matt with us too. So as usual with this Q&A, we're doing it live. So if you've got any questions that you'd like us to address, please put them in the comments on our Facebook page here tonight, and we'll do our best to answer the questions. And just as a reminder, this is a back to school special. So if people can try and focus on some of the issues that might be facing families in North Somerset as more and more pupils look to return to school this September, and we will return to our normal Q&As where we'll take all comers in terms of the questions in the future in the next few weeks. So I guess the first question, which I think I will direct to Catherine, is how do you feel about the return to school? How confident are you about the ability of our local schools to provide the support that's needed to enable children to go back safely?
Right, how do I feel personally about it? Let's not go down the route of what I feel about how the government has handled everything. I won't bore everyone with that. I think messaging could have been a lot clearer for parents, especially around the exams, and I think we've reached the point where the balance of risk for our children is such that we must encourage children to go back to school. I think that the point people keep making about the damage to their health, well-being and education by not attending school is outweighing the risks that they face in terms of the virus. Obviously, I can accept that a lot of parents are probably a little bit anxious about that. Not so much the risk to their children, perhaps they feel that their children mixing more are going to be possibly bringing the virus back into the home where there may be vulnerable people. And I'm fairly confident, not fairly, I'm very confident, and I know that our schools in North Somerset have been working incredibly hard throughout this period. They've had children in, they're very experienced now in managing the risks and setting up the classrooms in the appropriate ways for their school and following the government guidelines. So I'm very confident that our children will be safe. I think the teachers will be equally safe, and let's hope that we can manage this return to everybody's benefit. I don't know if any other colleagues have got more to add than I have already stated.
Thanks, Catherine. Sheila, is there anything you'd like to add from your perspective, and also perhaps elaborate on some of the things that the council's done to help schools prepare?
I guess my first message would be to echo what Councillor Gibbons has said, and again it's in line with the both the national and international advice we're getting from public health colleagues that where we are now in terms of the information we have about COVID-19, and more importantly, what we all know about the emotional well-being and health of our children, actually the risks of COVID-19 are far outweighed by the risks to children's emotional health and their learning if we continue for our children not to enjoy the benefits of an all-round education, which includes socialising safely with their peers. So I would want to echo that from Councillor Gibbons' perspective. So in terms of us as a council, many people will know that an awful lot of schools in North Somerset are academies, and so we work with our colleagues in the academies across North Somerset, and we in particular support our local authority maintained schools. And for quite some time now, we've had regular meetings with them. Colleagues in health and safety have given advice, colleagues from HR, from within the council. And in essence, since lockdown, we've worked together to make sense of the sometimes confusing guidance that's come out and sometimes the contradictory information. And we've worked also closely with Matt as the Director of Public Health, who's given advice to schools both collectively and individually, and we will continue as we move through this return to school and beyond to be there to support our colleagues in schools and to all just focus on getting children back into school safely.
That's great. Thank you, Sheila, and thank you, Catherine. So I'm going to come to you next, Matt, because we had a couple of questions from Erica, and some of them have already been addressed in Sheila and Catherine's initial remarks, but Erica was particularly interested to understand what the government guidelines say and mean about the way that children perhaps are at risk from COVID-19 in school settings, and also how social distancing will be managed in schools, and what that might mean for teaching staff as well. So I just wonder whether you might want to comment on that and add anything else from a public health perspective.
Okay, thank you, Mike. One of the most useful resources that's been published is a statement from the Chief Medical Officers for England, Scotland, Wales and Northern Ireland, which was published on the 23rd of August, which runs through the different elements of relative risk of young people returning to school, partly to do with the benefits around their social and emotional well-being, but also about the relatively low risk, particularly in the younger age groups, both in terms of an understanding that there's probably less likely to be infected with the virus, and most importantly for young people, even if young people are infected with the virus, it's much less likely to have an adverse effect on them in terms of their health. Less likely to have consequences, much less likely to be hospitalized or to have more severe outcomes. So there is, back to what they're saying in that statement, is it's about a balanced view of risk in terms of the whole person, relatively low risk for those young people. Not to say that some young people won't be more adversely affected, but overall, if you look at the percentages or the likelihood of that happening, it's relatively small. So it is a difficult balancing act, but the advice from those leading medical professionals is that on balance, it's probably the best thing to do. In terms of staff, they do actually identify staff as probably one of the more vulnerable groups. So there will be risk assessments that schools will have undertaken for how staff can be appropriately protected, how they can work together to reduce risk and work effectively with the students who are in their school. So it is about good conversations between teachers and pupils. It's about pupils talking to each other about how they're going to look after each other in the setting, and also that being reinforced, which we know parents are really keen to talk to children about the things that they can do. So it is all back to the same sorts of messaging which have been consistently promoted about maintaining distance where you can. We appreciate that that's a bit more troublesome in some parts of the school estate, but we do have the advice on face coverings now, which I think is helpful. Also about regular hygiene, so washing hands coming in and out of school. When you've been in certain situations as well, they'll be getting advice, pupils, when they return to school. And about that kind of kindness and just trying to notice that it's a difficult situation, but if we talk to each other, and people feel that they're able to say, I'm not comfortable with that, let's try and work it through together. It is about that ongoing conversation. It is a learning environment, and it's about learning a new skill set to try and reduce risk effectively. So on balance, the Chief Medical Officer's statement is a really good place to start, I think, and we can share links to that on our social media pages and others.
Can I just come in and on the back of what Matt was saying and just ask, or sort of say, my feeling is that children will be learning this set of behaviours that, in a sense, we all need to learn in order to cope with this situation. And I feel it'll be very beneficial because they're more able to adapt their behaviour than perhaps older people. So if they're learning that at school and taking those behaviours back home and encouraging their parents to be much more vigilant, I think that it will be beneficial for all of us. Would you agree with that point?
Yes, I think I would, because actually when we're talking about trying to assess risk on the evidence that we have so far, schools internationally are not being seen as a significant location of spreading of disease. It's more actually about in the social situations that adults find themselves in. So whether they're in restaurants, pubs, other social environments, that's the more likely cause for, so anything children can do, like they do in so many ways, bring lessons back to adults, and are sometimes very good at challenging adults in terms of what they should or shouldn't be doing. And I'm sure they'll have a positive effect.
Great, thank you. And certainly as a father of two children, one at primary school and one about to start at secondary school, I think it's important that as parents we recognise the great work that the schools are doing as well. And I know that it can be frustrating sometimes that you don't always think that you understand and have a handle on what's going to happen and how things are going to work. And I think we've got to be a bit patient with the schools, because clearly the guidance is changing all the time and that doesn't help. But I think overall they're doing a superb job to provide information and clarity and reassurance to us as parents and families. So good on them. So we've got a couple of questions which I'm going to direct to Don and Sheila, just around home to school transport. So we've got a few questions from Zoe and Yvette and Neris. And they've got some detailed questions about what's happening around home to school transport, but perhaps you can just comment on what are the arrangements, will it be operating as normal, where can people go if they've got concerns, and I think there's a bit of a recurring theme as well around perhaps the quality of the communication. So how well informed are parents, given how close the return to school is next week, how well informed are parents about what's going to be happening? So Don, do you want to kick off?
I will do. I mean, I think that the home to school transport issues have been part of the item you've just been discussing about the return to schools, about the fact that we do need to get our young people back into school. In many cases, we provide transport for them. And I know that our home to school transport team have been working very hard throughout the summer to facilitate that, to make sure there is the capability of us to get some children to school. And I know that in some cases, those arrangements have changed slightly. For example, where we've used trains in the past, we're now making arrangements to use coaches, for example, to go to Backwell School. And parents should be getting information on that in the next couple of days to give them the full information for their children return to school. I suspect that one or two people have criticised our communications, and I think that we'd accept that they've not been as good as perhaps they should have been. I perhaps suspect that it was an eagerness to inform people of the new background to getting to school, which the government is trying to encourage. They have a target of 50% of children at least should be either walking or cycling to school, and clearly we are taking measures to encourage that. I suppose the other thing is that there is a feeling around the school transport as well, that those that use public transport, given the fact that the volumes that can go on buses now is about 50% of what it was previously, and people are having to go back to work, and have other obligations which they need to travel at peak time. If we can have less children on the public transport buses, it then again frees up capacity, which is to a degree limited by the number of buses around, and they are running only about 50% of capacity. I don't think that I want to get into specific questions. We have an email address set up. If people have specific questions around home to school transport relating to their own children, that's schooltransport@n-somerset.gov.uk. So all lowercase, and school transport all is one word, again at n-somerset.gov.uk. I think the other point to bear in mind, of course, is that as is everything else that's happening, it's very much an evolving situation. Schools have been closed for quite a long time, so the ability to inform parents through the school network is, it's clearly not as strong as it was before, because actually we haven't got physically pupils in school. So communications have to be in a different way, and I'm very much hoping that in relation to the issues that have been raised around Churchill, that there will be sent out tomorrow a very long frequently asked questions document to explain the situation we have there. I think it's important to remember that we are working to a national set of guidelines in terms of home to school transport, in that the obligation set by the government nationally to us is that if any child under 8 has more than 2 miles to travel by a safe walking route to their school, accompanied by a parent, or equally anybody over 7, accompanied by a parent to a safe walking route of 3 miles, then it is for those parents to get their children to school. It's only if there's a safe walking route does not exist, then we are obliged by law to provide transport. And I think in terms of the context of some of the questions around Churchill School, for well over 40 years, children have travelled far less than 3 miles, purely because of that lack of a safe walking route. And throughout the rest of North Somerset, I'm sure that people that are listening to this call will be reflecting this, and sure, possibly from their own school days, they would have travelled that 3 mile journey to get to school, frequently every day, and did so over quite a long, prolonged period. Does that answer your question, Mike?
Thank you, Don, and I'll ask if Sheila wants to add anything. Just one point, and perhaps Sheila could maybe offer us some assurances on this one, and that is around a few people have commented that not only they're not clear about what's happening in terms of home to school transport, but they have raised queries and haven't necessarily had a response. So I wonder whether we can offer a assurance to people that we will perhaps get some focused support to the home to school transport team tomorrow to make sure that any outstanding queries are dealt with. I know we've got an officer who's working in the office this evening to try and respond to emails that come in during this Q&A, which is fantastic, and really grateful to him for that. But clearly there are some people who have got outstanding queries, so perhaps if we could maybe offer an assurance that we will look at that tomorrow and make sure that people get replies.
Yeah, so I think Don's given quite a comprehensive answer in terms of the the background and why we are where we are. But yes, in terms of if people have specific inquiries about their individual circumstances, I would reiterate, if you email school transport at n-somerset.gov.uk, if you do that from now, then as Mike said, there is a manager who is there who will be receiving those and dealing with them. I think what's what's unfortunate is we are sending out communications, but unfortunately some parents will only get those after this event. So I entirely accept that we probably could have done better in terms of our timing. I think just to say that we will ensure there's that extra capacity in the integrated transport unit, because we as much as parents want their children to go back into school, and I think what hasn't helped is we've had to wait quite some time, I think, for the actual guidance from the government, which came very late, and then trying to liaise with all the taxi firms and the coach firms who have also worked really hard with us. But I do apologise to parents who are feeling like they haven't had a response, and I do apologise on behalf of the council for that. But we will do our utmost to make sure that we respond to those individual queries, and if people can send them into that email address, then you'll receive a response. So my apologies again. Thank you.
And just to add to that, Sheila, and perhaps Catherine would want to come in on this, that as part of the guidance from government, there are staggered school start and finish times.
Yeah.
So parents need to make sure that their individual schools are informed of that. And one of the reasons, of course, is to try and make sure that we're not having mass arrivals and departures. So it is quite important to factor those new arrival times into the. And we have also in several schools changed the entrance and exit routes, particularly to get into the schools. So that again may be different to what you expect normally. And please don't be surprised if your normal route is classed as an exit only, and you're pointed to a different entrance into the school. Thank you. Sorry, I've interrupted you, Catherine.
No, and I'd add to that. Sorry, Catherine, I'd just confirmed that, and certainly I did a quick scan this morning on some of the websites of some of the key schools in North Somerset, and some have videos on, some have very much laid out the timings for those staggered starts, the new entrances and exits. And the consistent message also from our schools is, if you're in any doubt or if you have any concerns as a parent in regard to school, this is rather than transport, but if any doubts, just contact the school, and the head teachers and principals are making themselves available, as are other key school staff members. They're really keen to talk to parents if there are issues. But on the transport, I can say we will respond to those issues as a council.
Yeah, I was just going to come in on that and say much the same thing about contacting your school to ensure that you've got all the information about the particular measures there, and to reiterate the fact that yes, we have been waiting anxiously for the government guidelines on home to school transport, and to thank everybody that's working so hard to get everything organised, because I'm sure all parents can imagine that this is a huge piece of work in a very different world. You know, home to school transport has been something of an issue for us and for many people under normal circumstances, but under these circumstances and with changing situations and changing guidelines from central government, it has been a challenge. And we were hoping that the letters would have gone out to parents today, but it will be tomorrow. So hopefully you will get your answers. Thank you.
Okay, that's really helpful, everyone. So just to be clear to those listening, on home to school transport, letters should be going out soon to confirm arrangements. If you've got any concerns, please do email. You can do it now live whilst an officer is sitting there receiving the emails, but we'll make sure that everyone does get any responses so that any outstanding queries are dealt with. So the next question is from Michelle, and a couple of others have raised related queries. So I'm going to direct this one at you, Matt. And it's just asking what our advice will be to schools regarding the wearing of face masks and what the current position is. So this is another one that's a bit of an evolving beast in terms of the changing situation in terms of government advice. But will children be advised to wear face masks in schools? Will they be advised to wear them on transport?
So I suppose what we've had, as you say, is a changing picture in terms of the advice. What the more specific advice from government nationally has been that in areas of higher prevalence of transmission, that would be a routine wearing of face coverings. But what they're giving now is more discretion, I suppose, to schools to use that approach as they think it's appropriate within their setting. Most of the discussion has been about the movement in corridors or other communal spaces, whereas in the situation of a classroom, it should be more of a controlled environment where the social distancing measures are in place, where you have more control over the hygiene measures within that controlled space as well, so that face coverings are probably less necessary in that environment. So that's the overall guidance at the moment. Clearly, it would have been ideal to have had some of this guidance a bit earlier in the process of schools doing risk assessments and planning their approach, but at least it does give that flexibility to schools to adopt that if they feel that that's necessary. And obviously, we're seeing some schools making that decision now and see that as an important part of the overall measures that they're taking around distancing, hygiene, and of course making sure that if there's anybody who may have some symptoms of COVID-19, whether that's a pupil or a family member with a pupil, please do get your test booked as quickly as possible and isolate up until the point at which you're given a negative result. And so there's some assurance that it's okay for you to be within a school environment. So it's important to say that we as well as trying to prevent transmission, if there's any indication, any symptoms at all, then do try and book yourself in for a test. That's the best thing you can do.
Thank you, Matt. And what about advice specifically to some of the older young people and young adults who might choose to wear a face mask themselves? So I'm thinking particularly about those in sixth form or in college, where they may feel that they can independently make a decision about whether to wear a face mask or not in that setting. What would be your advice there?
Well, that's really interesting, because I was having this debate with my daughter a couple of days ago, who's just about to start at Western College. So she feels, probably not surprisingly, quite strongly that she would like to wear a face covering and feels empowered to be able to use that approach while she's at college. So I think, again, it's about creating an environment where those people who want to consistently do that are enabled to do that and feel empowered to make that decision. But what we do have, obviously, is in the settings, people are designing the flow of people, the seating of people. All of that approach has been thought out in a way to minimise the risk of further transmission. But it will be up to each setting to give clear indications to the students within that setting about what the expectations are, but also the flexibility for people to go a bit further if that's what they think is necessary. So yeah, it is a live issue, and I'm sure I'm having the same conversations as lots of parents across North Somerset.
I'd just like to come in and back up what you're saying. I was chatting to some young people who are due to go back to college this week, and all of them felt positive. They were happy that they would have the opportunity to wear a mask. As you say, they feel empowered. They feel it gives them a sense of participation. I wouldn't say control, but they do recognise the importance of it, which I think is really positive. As Mike knows, I'm a great advocate of mask wearing. I've been wearing one since March the 23rd on the advice of family members who work in medicine. So I think that it would be great if, what I was going to ask is, it's down to the setting. Would it be possible for a school to say, actually, we don't want you to wear a mask? That's my question, very quickly.
I'm glad you asked that, because that's exactly what I was going to lead into for Sheila, actually, in terms of, so I guess our message as a council would be that we would want school settings and college settings to have a conversation with parents, with pupils and students about what is the right solution in their setting, and what people are going to feel most comfortable with. And I guess that would be our message, to trust schools, establishments and communities to have sensible discussions. But do you have a view about that, Sheila?
I'd agree with you. So I think that schools, because they are keen to get students back, I can't imagine any of my colleagues in any of our schools actively saying, we don't want you to wear masks or face coverings to context of COVID-19. So that they wouldn't. And don't forget, we've been encouraging parents as a council that where they have anxieties to talk to the school. And if actually as part of that reducing the young person's anxiety, or the parents, if part of that is wearing a face mask, then that's good, because that then gets the young person back to school. So I would not envisage any school leaders in North Somerset, or indeed anywhere, to be honest, saying we don't want students wearing face masks if it makes them comfortable and feel safe and it's responsible.
That's good.
Thank you. Go on, Catherine. Did you want to? No, she's just agreeing, so that's good. So we've got another question, which I'm going to throw at Matt and Sheila as well, actually. So the question is from Carrie Ann, who wants to know, what about if you're a parent who is in one of the more vulnerable categories, be it because of a pre-existing health condition, or perhaps in some cases because of age, and you might feel more vulnerable and more at risk? What do you think should be the attitude in terms of sending children back to school? Is that that inherently increasing the risk that they'll bring it back into the home? And then a related point to that is around staff members who might find themselves in that category, and that's one for Sheila. What advice would we be giving to schools in that situation? So Matt, do you want to maybe talk about if a parent is in that position?
Yeah, sure. So no, I have empathy with people who are in that position, because if you've been very carefully managing your world up to now, and you feel some security from having that, there is a challenge about protecting yourself, but also probably wanting your child to get back into as normal a school life as possible. Back to the point about young people seem to be slightly less at risk in terms of being infected with the virus, but doesn't mean that they can't be infected with the virus, and then these consequences are less for them, but they could potentially transfer it back into the home. So I guess that's about having conversations. So I'm thinking at the moment there's a bit of a parallel here with people who work in hospital or the care sector, who go out into those environments and then come back into a home. And we would have had similar situations for people who have been more vulnerable, left in the home environment. So what we're seeing there is it's having conversations about being quite thoughtful and stringent about your return into the environment. So it's probably about going to change out the clothes that you've been in. It's about hand washing. It's about minimizing any risk of you transferring that back into the home environment, so that you've got a sort of clean break from where you've been from into home. That's a lot of the practical measures that I've seen people adopt to try and minimize the risk. I suppose there's risk in lots of things that we do in the day-to-day environment, not just going in and out of schools for any essential shopping that we might need to do. It might be about social interaction with friends or family, going into restaurants or other places. So they all come with an element of risk. It's very hard to take that out of the system completely. But I guess what we are seeing is good risk assessments in schools, which is trying to drive down that risk level as effectively as possible. And if the person coming in and out of that environment, or indeed on the way in which they travel to and from the school, if it's not walking or cycling, it's about thinking, how can you routinely reduce the risk in your day? And as you come back into the home environment, follow a few simple steps that might make it less likely for you to be able to transmit that virus. So it's all learning new patterns of behavior and just trying to get those ingrained from the start, and then hopefully that will provide some assurance. But I guess it's really hard to provide a fail-safe route for preventing any virus coming back into a household.
Thank you, Matt. And Sheila, just on the point about vulnerable staff members in schools.
Oh, and I think this has been an issue for quite some time, in fact, since lockdown, because let's not forget that many of our schools have never closed from March to July. They continue to educate and care for children of key workers and those of our more vulnerable children. So that's been around, and schools in doing that have been undertaking risk assessments, and those risk assessments have included where individual staff members either, for example, have been pregnant or do have underlying health conditions. And I think one of the things now is, as we're learning more about this virus, and as Matt said, there's the emerging views around, the risk to children and young people is probably less than we might have thought back in March. Then again, it's about that member of staff having conversations with the head teacher and looking at how the risks can be reduced, not just though in the school, but also, as Matt said, in terms of their home environment and also the travelling to and from. And it is about weighing it up. You can't remove risk. And I think the other key point here is that people with underlying health conditions do need to have a conversation with their GP and then look at what their job role is, and then have conversations then back in the school about what mitigations can be put in place around hygiene, around maybe wearing face masks, so that they are able to return to their job, because this is going to be here with us for quite some time. And it is about both mitigating risk, but acknowledging that, we have got to find a way of being able to get people back in safely, but the anxiety levels being reduced as well. So it's tricky, but I do think there's two avenues. One is the GP and the medical advice, and the other one is also discussion with the head at the school around the risk assessment.
That's great. Thanks very much, Sheila. So I've got a couple of questions related to the wider transport landscape, which I'm going to direct at you, Don. Claire wants to know when timetables will be put back on bus stops so that people know what the times and the operating schedules for buses are going to be. And there's also a related question around train services and whether they will be operating as normal through North Somerset once schools go back, because obviously a number of students do use the train to access school.
If we go onto the trains first of all, the social distancing rules apply throughout on the trains that wearing face masks and less seats available. My understanding is that GWR are going to enhance their timetable to take into account that there are going to be more people moving both to work and to school over the next several weeks, and I think it's just a question of checking the timetable. In terms of the buses, well, as you'll know, there's been some relaxation in terms of the social distancing on buses, that now they're about 50% capacity. Everybody should wear a face covering. There's a degree of service operation with the duplicate services, so that if a bus is full, there is often a bus following a few minutes after it to make sure nobody is left to the stop for an hour or half an hour. In terms of the information on the buses, that's somewhat more problematic. I mean, I think even a dinosaur like me now looks at nothing for paper to go on the buses. I use the various bus apps like Bus Checker and the First Bus app, because those are the ones that are up to date. And to be fair to the bus service providers, they've been able to change the timetables extremely frequently, and to try and get those onto bus stops in paper form is quite difficult in terms of the manpower and questions, issues about social distancing, and particularly some of the larger stops about people having to do the posting of the times when there are lots and lots of people around, so issues about social distancing, that type of thing. And of course, they're often wrong by the time they get them out, that the times have changed. So I'm kind of assuming that as the person's asked the question is accessing this through Facebook Live, they have a degree of dexterity on social media at least as great as mine, which is a very low base. So I would suggest use those apps like Bus Checker and using the First Bus apps to do them. If you buy your ticket through there, they're also cheaper, and it avoids usually handling cash, indeed having to do any interaction with anybody when you're getting on and off the bus. But do be aware of the fact that the timetables are changing quite frequently because of the change in demand. I think the current ones are on for a couple more weeks, and they may well change again in September, partly because of the increasing number of students that are going to be returning to the West of England area more generally, of which quite a few live in North Somerset and access both the universities in Bath and in Bristol through public transport, be it train or be it by bus. So I haven't really answered the question about the bus stops, but I think I would tend to use the apps. From my own experience, they are by far the best method for getting the accurate, up-to-date information. The one thing I would say in terms of bus services, which has been brought to my attention in the last week, is that because of some changes within Bristol City Centre, which I would wholly support in terms of social distancing and widening of cycling and walking routes, some of the roads are constrained around the bus station, which has meant a lot of the North Somerset services have been delayed. I've spoken personally to the Mayor of Bristol about the impact of these, and they are due to be reviewing them to make sure the buses operate fully to time. But that is why some of our Excel bus routes are running late. Thank you.
Great, thank you, Don. And we've had a couple of questions from Lorraine and Anne, particularly around access to Backwell School, and especially the difficulties of accessing Backwell School through Station Road, where the pavements are particularly narrow. So there has been quite a lot of focus work by the school and the local councillor Bridget Petty and our officers to look at how we can do better in terms of managing access to Backwell School. Some work has been done to improve access through the leisure centre. I know that the car parks at the two pubs are going to be available for a sort of park and stride arrangement to access the school. We have also looked at the options for widening the pavements on Station Road, but unfortunately it's not straightforward because it would require road closures or a one-way system, both of which would have problems that would just cause displacement of traffic into other less suitable roads. So the risk is that you might solve the problem in Station Road but make it worse somewhere else. So certainly a lot of work has been undertaken to try and improve things, but what I would say is, and in common with lots of other schools across the district, please give us feedback on how it feels and what the practical experience is like, particularly with the staggered start and exit times, so that we can revisit these things when we've got a bit more practical experience of what it's like. I think it's very difficult for schools and for our highways officers to plan in too much detail about some of these arrangements, because we really don't know quite how many people are going to walk, how many people are going to cycle, what the vehicle movements will be like, and what decisions people will make around how to get to school safely. So please do keep feedback coming into us so that we can keep that under review.
Just on Backwell School,
yeah,
Mike, just in case anybody's not heard, the pupils that are currently, or up until now, have gone by train from Yatton Station to Nailsy and Backwell Station. That service will be replaced by a coach service in the short run until we sort out the issues in terms of capacity on the train and safety for pupils thereon. And all parents will be an email with information or contact with information about that, given the times of the coaches.
Thank you. And the next question, which is from Michelle, and actually there was a related one, which was, I think, from Erica. So I'll direct this at Sheila and Catherine. So Michelle wants to know what the attitude to flexibility over the staggered start times will be. So particularly for parents who might have children that go to different schools, it won't necessarily be all that straightforward to transport children in those circumstances. So what advice do we know schools are likely to be issuing in those circumstances? And then Erica's question was around whether parents who decide to keep their children at home will be fined.
Shall I go first and then pass on to Sheila for the more expert opinions? I would say that in terms of the staggered drop-off and the issues that parents face if they've got one child going to one school and another going to a different one, and there are staggered starts that vary with the two schools, that like everything else, you're going to have that conversation with the school and with the head teacher to work out how you get around that. In terms of the fining, we've said as an administration, we would not be looking to fine people as they start to grow in confidence and get their children back into school. We would certainly expect parents who have anxieties and problems over this and don't want to send their children back to school initially to again have that conversation with the school and with the heads and work with them. And whilst that's ongoing, we certainly wouldn't be fining parents when we're aware that they're trying to deal with their anxieties and do the best they can to feel confident in sending their children back. I don't know what Sheila has to add on those points.
So I just reiterate that, so when, in particular, the last bit around parents not wanting to, we would impress upon people wherever possible, actually school is probably the best place for your child to be in terms of their social and emotional well-being. If you feel very strongly about that, then obviously I know that some parents have elected to home educate their children permanently. The issue about penalty notices, that would be a last resort. What we are saying to parents who are contacting us who are anxious about it, we are strongly encouraging them to speak to the school leadership because they understand that and they know the children, and they know what the children will need. And certainly we're not going out there looking to impose penalty notices, but there may come a point later on when actually the school have put mitigations in place, and children are maybe wanting to go back to school, and then we would be quite concerned about parents keeping children off in those circumstances. But I would emphasise our starting point from next week is not to say we are going to be looking to issue penalty notices. We would be strongly encouraging parents to talk to the schools, and we would support them then in trying to get their children back into school with the least amount of anxiety.
Super, thank you. Thanks very much, both. So the next question is for Matt, I think. And I've lost track of who the question is from now, which isn't very helpful. So apologies for not giving you a name check. But could you just tell us what would happen if either a member of staff or a pupil in a school setting, once they've returned, develops a positive test for COVID-19? What's the procedure, and how are parents and families notified about that? What will they be expected to do in those circumstances?
Okay, so well, normally if it was a single case of somebody having COVID-19, you would manage that case as an individual case. So you would follow the normal process. Person has a test, they self-isolate while awaiting a result, and then they and the family members, so it could be the young person or it could be the parent or carer, whoever it is in the home setting, is positive, then you would have somebody not returning to school because of that reason. Where we get into more of a coordinated approach is if we have two or more cases, then we would start to investigate whether there are any links between those cases. Is it just about school, or would there be any other reasons why those two cases of pupils within a school, or two teachers or other teaching staff or other support staff in a school, is a reason why they both have the virus? And you're basically trying to eliminate whether it is the school as the common factor or something else. So it's risk assessed on that basement, but what we do is we tag cases as they come in. So you look for associated causes, whether it's related to schools, it might relate to a social situation like a pub or a restaurant environment, it might relate to a place of worship or another setting. So you would look for the factors that combine to make you look into it, and then risk assess whether there is more action that you need to take. And what we normally do when you start to get into what we would call a cluster of cases, so that's two or more, you set up an outbreak control team. So that's involving both us in terms of local authority public health and our colleagues from Public Health England in the health protection team there across the southwest. And then we do that bit of systematic understanding of what's going on, and then address any risks that there might be associated with that cluster of cases. So that's the principle. How you work it in practice is relating to the exact environmental conditions. What you could have in that situation is a cluster or a cohort of people being suggested that they might need to isolate. You might also need to do something around deep cleaning, but that's all very much based on the individual circumstances of that school setting or educational establishment, and a risk assessment that we would work through to try and work out what's the most effective action and how can we follow that through. So, but that's a run through the principles of how we try and spot associations between cases, and then we would do the detailed risk assessment from there. So I hope that's helpful and gives some assurance that that's a process that we use quite routinely, and that's worked before coronavirus. That worked in other communicable diseases that may have been in schools, for example, meningitis or measles or other things. We would use exactly the same sort of approach. So it's tried and tested, I suppose. We just have to adapt it to the new virus that we need to take account of.
Thanks, Matt. That's really helpful. And the next question is a related point, which I'll also direct at Matt, from Kelly, which is really asking about what the process would be in terms of any future closure of schools and a reining back of the wider reopening and wider return to schools, and what the thresholds and triggers for that might be. I suppose it's worth predicating that question with emphasising that at the moment we continue to have very low case rates here in North Somerset. So, we are below the regional and national average in terms of our current levels of cases. So there is no reason at the moment for us to be concerned about the overall levels of COVID-19 in the community in North Somerset. And obviously what is true of the wider community is also true in schools, and they're no more inherently risky than workplaces or many of the other places that have now reopened and people have been enjoying. I mean, certainly over the month of August, a lot of our restaurants and public houses have reopened. They've enjoyed a busy time, and we haven't seen a spike in cases. And I think that's a testament to the hard work that businesses have put in to putting the right arrangements in place, but also all of us as residents and consumers in washing our hands and wearing face masks and trying to practice social distancing where possible. But Matt, any thoughts on what might be a trigger point in the future, and what the approach would be, and whether there's any experience from elsewhere in the country where localized lockdowns have happened, and what has that meant for schools?
Yeah, so it tends to be a range of measures, and I think you make a really important point there. One of the key indicators is around what's the prevalence in the local population at any one time. So we keep a daily eye on how many cases we've got in North Somerset, and if we start to get an increase in cases, then we'd really want to understand, so who is being infected and why. And that's a process that we actively go through, and we've seen that in other places who have had higher rates of cases. And in fact, we had a totally separate but an interesting learning experience around a large number of cases associated with Western Hospital a few months ago. But that showed that the system is there to be able to get underneath the data, to understand a bit more about what's going on. And then it's all about targeting where you are actually finding the cases. So it may be in some schools, but it may not be in educational establishments. It might be more related. Most of the spikes in cases that we've seen so far have not been about schools. And actually in recent weeks, they've not even been about care homes, which was another area of concern in recent months. It's been primarily about particular workplaces where there are people working much closer together, where some of the systems in place were not ideal, and therefore the virus started to spread quite quickly. And then it was about getting in there and making sure that you could test all of the people within that setting and put in place the appropriate measures to isolate and to address the risks that there may have been associated with that workplace. For example, car sharing or other common places of contact within communities, whether that's in households or other settings. So it's all about the investigation to work out what is proportionate and what is appropriate to be effective. If it was about a school, it may not be about closing a whole school. It may be about looking at a particular part of the school or a particular year group or a classroom or other things where you might take additional measures. But I think closing of schools in relation to an outbreak would be something you'd need to be really clear that that was needed and appropriate, and that would all be about working with the school, with the senior staff in the school, with the parents, with the students themselves, and making sure that people understood why that might be necessary and knowing that it was going to be an effective action. But we would be looking at all of the settings within North Somerset that might be behind a rise in cases, rather than just being kind of one size fits all in our approach and looking to affect schools. Because as we started off saying how important schools are to young people as a means not just of educational development, but social and a kind of peer support, all of those things, they're very valuable to young people. And as sort of people trying to prevent any harm to young people, we want to see them thrive in schools as much as possible. So we'd look at the local situation. We obviously have to take account of national guidance as well, because that may come at us in a different way if there was a much larger national wave and then there were more directive approaches from government saying this is what we want to happen in all schools. But I think thankfully over what we've seen recently is this permission to be a bit more nuanced and to work out what's appropriate in each local place, and to take those actions and to do it in collaboration with the people who are most affected. So in this case, the students, the parents, and the teaching community as well. So that's the way I think we'd want to handle it.
Thanks, Matt. Can I just make one point,
Yeah,
a bit of
on.
advice to Matt? Yeah, thanks for that. There is one thing about children going back to school we need to emphasise, minimising risk, and that is about lift sharing, isn't it? There is some quite specific advice around lift sharing of taking pupils back to school, and I don't know if perhaps I'll leave it to a scientific officer to explain those rather than my rather gabbled personal interpretation of the rules.
Yeah, I was going to raise that as well. That would be really helpful if we could remind people on what the guidelines are in car sharing, especially as a lot of parents have relied on that in the past.
Yeah, so the guidance is about trying not to share across households. I mean, ultimately, because that is a potential source of additional risk. But if it is required for whatever reason, then to try and take some precautionary steps to prevent transmission. So that's about wearing face coverings in the car. It's about trying to keep the windows open. It's also about how you can situate people in the car. So ideally, if you've got a driver in the front right, you would probably want to have the passenger in the back left if you were trying to think about the layout of a car. So you've got the greatest distance possible. It's also about not directly talking at people. You want to, move your conversations at an angle rather than directly at people, but the face coverings really help with that as well. And about making sure that any surfaces that may have been touched going in and out of that car environment are wiped down and sanitized essentially. And when you get out of the vehicle, make sure you wash your hands for at least 20 seconds or use the hand gel to sanitize again. So there are steps. And there is some guidance actually on the gov.uk website, partly in relation to educational settings, but there's also guidance there about taxis as well, and how people can be as safe as possible if that is a mechanism by which some people go to school. So I would point people towards that guidance just to look at it and just think carefully each time you get in the car, ways in which you can try and reduce that risk.
And I guess, Matt, as well, emphasising the fact that try to share with the same people all the time. Don't mix the groups you're sharing with.
Yes, that's right. Because then, if there was a case, you can contact trace very quickly and effectively, and stop the spread in a very small, almost like the bringing of the bubbles together that we had when lockdown lifted. If you keep the contact of the bubbles very small, then it's a much more controllable situation if somebody does get COVID-19.
Great stuff, thank you. Right, we're down to our last 2 minutes, so I'd like to encourage everyone to fast track their answers to see if we can just polish off a few more in the last couple of minutes. So a couple of questions from Fiona for you, Sheila. The first is around what will the advice to schools be about attendance records in respect of things like self-isolation or symptoms, and how will that be monitored and what will the impacts of that? And also, are the schools planning ahead already in terms of the potential for loss of time in school if people are ill or unwell, or if any school closures have to take place again, or if future examinations or testing is postponed?
Right. Remind me of the first one, Mike. Sorry, what was
so the first one was just about attendance records and what advice has been given to schools about that, and I guess not just now but throughout lockdown.
Right, so basically the advice that schools receive about attendance and whether it's authorised or unauthorised absence comes from the Department for Education. It doesn't come from local authorities. The Department for Education will have been giving that advice out, so it's consistent. So that's my first answer. Next one.
And the next one was about what contingency planning are schools putting in place in terms of examination impacts or temporary closures or anything like that. Are they already future-proofing themselves for those kinds of contingencies?
I would have to say I've not had any particular conversations on that score. They will have already the risk assessments and the action plans they put in place from March. I would say that at the moment, in all honesty, the school's focus is much more on getting students back. I think that they've also, though, taken on board the advice that Matt's also raised, which is about actually the government's learning from this lockdown is that in future schools will not be the first places they're going to look to unless there's an outbreak in the school, which, you know, the risks are far greater in other settings. And so actually, the premise that schools will be working on is that schools will remain open. Now, so in terms of things like the exams, again, nobody could have foreseen in March that actually we were going to end up with the fiasco that we did around A-levels and GCSEs and so on. So schools will be taking that into account, but they will be planning on the basis of a different way of operating should there be future outbreaks in communities. And it's much more, as Matt's been saying, about, you know, tracking, testing, tracing, all of that, looking out to where an outbreak has happened and seeking to minimise that. So no, I would have to say, maybe regretfully for Fiona, I don't know, but that no, schools are focusing on getting students returned, and that the risks around possible disruption they'll be looking at when students are back in school. And I can say that we will absolutely have a discussion about that with all our schools post-September when they're back.
Great, thank you.
Sheila, will there be an algorithm for that, do we think?
I don't think we do algorithms in North Somerset.
Oh, good.
I personally don't. Don't ask me.
Not mutant one.
No.
We haven't got time for jokes. Sorry, Don. We've reached the end of our time, and we've tried to get through as many questions as possible. I hope this has been helpful. Feel free to carry on commenting on our Facebook page, and we will try and get back to you with as many responses as we possibly can. One thing that I do want to say in final summary is that we've all noted the significant number of comments about home to school transport and the lack of clarity and certainty about that. And I think everyone is going to take that away and make sure that we do better on that one. And just to echo what Sheila said earlier, you know, I am sorry if people have found this a frustrating and an unsettling period. It has been particularly difficult, as Catherine said, to navigate our way through this process with a lot of uncertainty and ever-changing government guidelines. And I know our officers have done their best to keep people in touch, but we will absolutely listen on that and take that away and try and do our best. The only final thing I wanted to say on in terms of public health was just to say, as a parent, I think it's important that we just recognise that the world has changed in the last few months. I think some of the uncertainties that we had in the early part of the pandemic are clearer, and I think that's why we can have more confidence about the return to school. We can have more confidence that we've got the processes and the advice and the testing and tracing procedures in place, that our public health teams here locally and nationally have got a better handle on the situation. We've got the data and information so that we can monitor the impacts and the cases locally, and we can have more confidence to make assurances to you about what's happening and that the right interventions are being taken. So I think the world has changed and moved on, and I think that's good, and we can hopefully all send our children back to school next week, whether they like it or not, with a lot more confidence than would have been the case earlier in the year. Catherine, any final comments that you want to make before we wrap up?
Yes, I'd just like to thank everybody for being here, and for Sheila and Matt to be here and give us such comprehensive answers. And I hope it's been helpful to people who've been watching, and we've allayed some of their fears and worries. And just to say that, yes, as I said in the beginning, we have reached that point where it is better for our children to go back to school than not. And that is the balance of risk. A recent report, a study by the YMCA, revealed that 57% of young people in secondary school stages were anxious about the future because they have missed so much school. Those who will be taking exams next year were becoming anxious. We have to make sure that this doesn't escalate. We need to get them back. We need to get them back in the right environment. And I'm absolutely certain, well, I know that we're doing all we possibly can in North Somerset, in our schools and as an administration, to facilitate that and give parents the confidence to get their children back.
Superb. Thank you, Catherine, and thank you, Sheila, Matt and Don for joining this Facebook Live, and thank you everyone for watching, and we'll see you again next time.
Thank you.